Welcome to AllAboutRx. Today, we are breaking down one of the absolute most high-yield topics in biochemistry, vitamins. We're going to explore how these essential organic nutrients are classified, look closely at their fat-soluble versus water-soluble properties, and really dive into the individual coenzyme functions, clinical deficiency states, and their toxicities. Whether you're reviewing for a big exam or you just want a much deeper understanding of human metabolism, you'll see that these tiny organic molecules are essentially the invisible engines driving our cellular machinery.
Okay, let's dive into this. Here is our roadmap for today's explainer. First, an introduction to vitamins. Second, fat-soluble versus water-soluble. Third, the fat-soluble vitamins. Fourth, the water-soluble vitamins. And we'll wrap up with 5, the high-yield clinical pearls.
So let's kick things off with Section 1, Introduction to Vitamins.
Before we start sorting them into buckets, let's actually define what we're dealing with here. Vitamins are essential organic nutrients, and we require them in really small amounts to facilitate metabolism, growth, and general biochemical functions. Now, unlike carbs or proteins, they don't actually provide energy themselves. Instead, they act as these vital facilitators in tiny, almost microscopic amounts. Without them, our biochemistry literally grinds to a halt, and that results in very specific nutritional deficiency diseases. We can separate these molecules into 2 main taxonomic families, the fat-soluble vitamins, A, D, E, and K, and the water-soluble vitamins, which include the B complex and vitamin C. While we do get most of these from our diet, cereals, fruits, meats, it's actually super fascinating that we aren't entirely dependent on food for all of them. Our normal gut flora actually synthesizes some of these for us, specifically vitamin K, niacin, biotin, folic acid, and B12.
Moving right along to Section 2, fat-soluble versus water-soluble.
This brings us to what is arguably the most important foundational dichotomy in all of biochemistry. How our body physically handles and processes these 2 distinct groups pretty much dictates everything about their clinical impact. Let's keep contrasting these traits as we go. So, fat-soluble vitamins require dietary fat just to be absorbed, and they travel into the lymphatics packaged up inside chylomicrons. Because they love lipids, they're heavily stored in the liver and in our adipose tissue. But, that makes them a real double-edged sword. Because they build up over time, they have a much higher potential for toxicity if you take too much. Water-soluble vitamins, on the other hand, well, they wash out of the body super easily. They're generally not stored and they're excreted much more readily into the urine. That means toxicity is incredibly rare, but the risk of developing a rapid, severe deficiency state, well, that's much, much higher.
All right, Section 3. The fat-soluble vitamins. Let's dig into the fat-soluble stash, vitamins A, D, E, and K.
These fat-soluble vitamins serve incredibly diverse physiological roles. We're going to start with vitamin A, which is also known as the retinoids. This is a family of molecules that includes retinol, retinal, and retinoic acid. Retinal is absolutely the key driver of the visual cycle in your eyes. It specifically handles the interconversion of 11-cis and all-transretinal inside rhodopsin. Retinoic acid, meanwhile, is what drives the growth and differentiation of epithelial cells. It's what maintains your overall epithelial integrity. But here's a crucial chemical fact to remember. These molecules are super fragile. They are easily oxidized and destroyed just by cooking, or they get inactivated by hydrogenation during processes like, say, making ghee.
Clinically speaking, untreated vitamin A deficiency paints a pretty tragic picture. It usually starts out as night blindness, but if left untreated, it leads to irreversible visual cell loss and something called xerophthalmia. This is a severe drying of the cornea and conjunctiva, and sadly, it causes hundreds of thousands of children to go blind every single year. On the flip side, toxicity is a very real danger here. Doses over 7.5 milligrams per day can lead to dry skin, an enlarged liver, and even symptoms that mimic a brain tumor. We also absolutely must warn that isotretinoin, which is commonly used to treat severe acne, is highly teratogenic. That means it can cause severe, devastating birth defects.
Next up is vitamin D, or calciferol. Interestingly, vitamin D actually acts way more like a hormone than a traditional vitamin. It plays this critical role in regulating our calcium homeostasis. It literally complexes with nuclear proteins to directly regulate gene expression, keeping a super strict management over our body's calcium and phosphorus levels. Now, while we do synthesize a precursor in our skin using UV radiation from the sun, it ultimately has to travel all the way to the kidney to be converted into its final biologically active form, which is called calcitriol.
So, what happens when vitamin D is deficient? Basically, bone mineralization fails. In growing children, this yields rickets, which is characterized by soft, pliable, bowing bones. In adults, it causes osteomalacia. That's a demineralization of the existing bone, leading to some pretty frequent and severe fractures.
But again, remember, because it's fat-soluble, extreme doses can cause severe toxicity. It pulls massive amounts of calcium right into the blood. This dangerous hypercalcemia can literally cause calcium to deposit inside your arteries and kidneys, which is definitely not what you want. Rounding out the fat-soluble group, we usually group vitamins E and K together to really contrast their distinct roles. Vitamin E, or tocopherol, acts primarily as a lipid antioxidant. It essentially sits inside our cell membranes and acts like a shield, protecting them from being damaged by free radicals and oxygen. Vitamin K, on the other hand, is a vital coenzyme, and it's produced largely by those helpful gut bacteria we mentioned earlier. It has one major job in the liver, supporting blood clotting factor carboxylation. That process matures clotting factors 2, 7, 9, and X so they can actually do their job and stop you from bleeding.
So the crucial point to take away here is this. Vitamin E is incredibly safe. It's actually the least toxic fat-soluble vitamin. But a vitamin K deficiency, that is a massive clinical red flag. Without it, you develop hypoprothrombonemia, which means you bleed very easily. And here's where it gets critical, because newborns are born with a completely sterile gut, meaning they don't have those helpful bacteria yet, and because breast milk simply doesn't have enough vitamin K, providing a prophylactic intramuscular injection of vitamin K right at birth is an absolute non-negotiable medical necessity to prevent hemorrhagic disease.
Okay, let's shift gears to section 4, the water-soluble vitamins. This is our B complex and vitamin C.
So with the water-soluble vitamins, the whole narrative completely changes. These guys act primarily as vital coenzymes in energy metabolism and cellular reactions. We go from worrying about storage risks and toxicities to worrying about the rapid onset of deficiencies if we don't consume them regularly. Let's introduce vitamin B6, or pyridoxine. Its active form is pyridoxal phosphate, or PLP, and it is absolutely essential for amino acid metabolism, particularly transamination and decarboxylation reactions. But what you absolutely must remember about B6 is that it is uniquely the only water-soluble vitamin with a clinically significant toxicity profile. If taken at massively high doses, like over 200 milligrams per day, it can cause a severe sensory neuropathy, and recovery from that is often only partial.
Now, what's really interesting about this is how B6 interacts with pharmacology. Isoniazid, which is a very common drug used to treat tuberculosis, chemically reacts with the active PLP form of vitamin B6. It forms this inert, inactive complex. This literally pulls the active vitamin out of commission, causing a functional deficiency that shows up as numbness and tingling in the hands and feet. Because of this, clinicians are absolutely forced to give vitamin B6 as a mandatory adjunct therapy whenever they prescribe isoniazid.
Let's execute a rapid-fire review of the rest of the major B-complex enzymes because their deficiencies result in very distinct clinical conditions. Vitamin B1, thiamine, is vital for cellular energy. A deficiency yields Beriberi, which can be cardiovascular or neurological, or Wernicke-Korsakoff syndrome, which we frequently see in chronic alcoholics. Vitamin B3, niacin, causes pellagra when deficient. That's famously characterized by the 3 Ds, dermatitis, diarrhea, and dementia. And B7, biotin, plays a huge role in carboxylation. Interestingly enough, a B7 deficiency is famously, and almost exclusively, caused by consuming massive amounts of raw eggs. That's because a protein in the egg white called avidin binds to the biotin so tightly that your body just can't use it.
Let's look closely at folic acid, or B9, and cobalamin, which is B12. These two vitamins are heavily chemically linked. They are crucial coenzymes for one-carbon transfers and purine synthesis. In plain English, you need them to make DNA. If you lack either one of these, your body's ability to synthesize DNA is severely impaired. The fastest dividing cells in your body, which are your red blood cells, fail to divide properly, and that results in large, structurally immature red blood cells. Clinically, we call this megaloblastic or macrocytic anemia.
Clinically, though, B9 and B12 have some stark differences. B9 is absolutely vital for pregnant women. Supplementing to 0.4 milligrams a day before conception radically prevents fetal neural tube defects. B12, on the other hand, is the one bizarre exception to the water-soluble rule. It is actually stored in the liver, and in such high amounts that it literally takes years to deplete. So a B12 deficiency is rarely dietary. It's usually driven by an autoimmune destruction of the stomach's parietal cells. That means you lose the intrinsic factor needed to absorb B12 in the first place, a condition called pernicious anemia. And a huge warning here, giving high doses of folate can actually correct the anemia, but dangerously mask a deteriorating underlying B12 deficiency.
And that brings us to our final water-soluble hero, vitamin C, or ascorbic acid.
Beyond being a powerful antioxidant and helping your intestines absorb dietary iron, vitamin C's most critical biochemical job is acting as a coenzyme in the hydroxylation of procollagen. Essentially, it takes the amino acids proline and lysine and modifies them so that collagen molecules can cross-link and weave together strongly. It is the ultimate builder of normal connective tissues and wound healing matrices.
So when that biochemical failure of collagen hydroxylation happens because you're lacking vitamin C, your connective tissues simply fall apart. This leads directly to the very visual, often gruesome symptoms of the disease scurvy. Patients develop incredibly sore, spongy, bleeding gums. Their teeth get loose and can literally fall out. Their blood vessels become so fragile they rupture easily under the skin, and even minor wounds completely fail to heal. It's a pretty stark reminder of how missing just one molecular coenzyme can systematically dismantle the entire body.
Section 5. High-Yield Clinical Pearls. These are your must-remember facts.
All right, let's transition into our climax section. We're going to rapid-fire the absolute must-remember, highly testable facts from this entire biochemical breakdown. These are the connections you really need to lock into your memory. Ready? Number 1. Newborns absolutely must good vitamin K prophylaxis at birth to prevent severe bleeding. Number 2. Treating tuberculosis with isoniazid will cause a vitamin B6 deficiency, so you always co-administer them. Number 3. Eating excessive raw egg whites depletes biotin because of the binding protein avidin. Number 4. High-dose folate administration can dangerously mask an underlying B12 deficiency. And number 5, an autoimmune loss of intrinsic factors stops B12 absorption entirely, and that leads to pernicious anemia. Lock these in for sure.
We've covered some incredible ground today, but here's a provocative thought to leave you with. As humans evolved into the highly complex organisms we are today, why did we completely lose the biochemical machinery to synthesize these vital molecules ourselves? Why is our survival entirely at the mercy of our diet and our environment? It's a fascinating evolutionary trade-off to think about. Thank you for tuning into this lecture. If you found this breakdown helpful, please make sure to like, subscribe, and drop a comment below with any questions or topics you want covered next. See you in the next explainer.